Today I'm going to talk about pulmonary function tests, or PFTs. These tests are a non-invasive breathing test to show you and your doctor how well your lungs are working. PFTs are incredibly helpful, not just in the diagnosis of your lung disease, but also in prognosis and evaluating the response to the treatments that your doctor may prescribe. There are a number of measurements that are performed during a PFT, each providing critical information to your doctor about your lung function. Before performing a PFT, there are some important things to know. While these tests are non-invasive, they do take some physical effort, and because of that, patients may experience some discomfort, such as coughing or lightheadedness. We also do not recommend performing PFTs if you've recently had a severe medical condition, such as a surgery, including eye surgery, a heart attack, or a stroke. During the test, a specialized pulmonary function technologist will instruct you through the different breathing maneuvers you will need to perform and will counsel you on what to expect. The first test we'll talk about is lung volumes. Lung volumes are typically measured by a technique called plethysmography. In this test, you will be asked to sit inside of a closed glass box, similar to a phone booth, while performing some breathing maneuvers. If patients are claustrophobic or have issues sitting in the box, other testing techniques may be performed. This test will tell us how much air your lungs can fully hold when you inhale, and also how much air is left in your lungs when you fully exhale. This test can help determine if you have restriction of your lungs, which is often seen in our patients with interstitial lung disease. The next test, spirometry, is a very reliable test that measures how much air you can actually move in and out of your body when you inhale and exhale, as well as how quickly you can move that air. The two main measurements of spirometry that your doctor will look at are the FVC, or forced vital capacity, and the FEV1, or forced expiratory volume in 1 second. The FVC is the total amount of air that you can blow out of your lungs. It is measured by having you take the biggest breath you can and then forcibly blowing it out as fast and for as long as you can through a tube called a spirometer. During that maneuver, the FEV1 is also measured and is the amount of air that comes out in the very first second of exhaling. These two measurements can help identify types of lung impairment, such as obstruction, which can be seen in asthma or COPD, or restriction, as is often seen in interstitial lung disease. The last test, the diffusing capacity, or DLCO, is a measurement to determine how well your lungs do at getting oxygen out of the air and into the bloodstream. This test involves breathing in a certain type of gas and holding your breath for about 10 seconds. In many lung conditions, including interstitial lung disease, the diffusing capacity is decreased, either due to destruction of the alveoli, the little air sacs of the lung where the gas exchange occurs, or issues with the blood vessels that course through the lungs. Typically, after you have performed a PFT, your doctor should review the results of the PFT and inform you what those results mean to your specific medical condition. Your doctor will want to follow some of these tests closely over your treatment course to see how you're doing and help guide decisions about therapies.